going to go ahead and get started. I want to say thank you to all of you for taking time out of your busy schedules to be with us today. The information that we hope to obtain is very important to our community to help us understand what the needs of our community are and what we can do about those. So, Lara, this is Laura Brooks from Stillwater, and she's going to help us through this process. So I'm going to turn it over to her. Thank you.
Well, I'm Laura Brooks. I'm with Oklahoma Cooperative Extension Service, and I'm on campus in Stillwater. I'd also like to introduce Karen Armbruster. Y'all probably all know Karen, but she is here in Woods County, and she's a great local resource for extension. And Rod Hargrave with us. He's with the Oklahoma Office of Rural Health in Oklahoma City. And I'll explain more about kind of how our offices work together. Can everyone hear me all right, or should I stand in front of the microphone? Okay. Rod will be going around giving handouts, the economic impact, if you haven't received a copy, also a copy of the survey, if you haven't received that also. So he'll be making the rounds while we go through the presentation. If you have any questions at all, let me know. We're going to talk about some economic data today, and it can be overwhelming. So just stop me because I can get really wrapped up in the numbers. So just overall, what we're hoping to do today, we're going to explain what the Community Health Needs Assessment is, kind of the history of it and why we're doing this. I like to say we like to start big and then get down small. We're going to start talking about some national healthcare trends, then talk about some county, Oklahoma healthcare trends, and then get into what is the economic impact of your local health sector. So just what is the Community Health Needs Assessment and why are we doing it? Over 20 years ago, the Oklahoma Cooperative Extension Office and the Oklahoma Office of Rural Health came together to offer the community health engagement process. And I believe the last time we conducted that process here in Alva was probably 12 years ago, 2001, 2002. I don't know if anyone was present for that. But the overall goal through the engagement process was to get people energized, engaged in the local health sector. Have local people using local services, helping determine what services need to be offered. Well, then the Affordable Care Act came in 2010, and there's now a requirement for all nonprofit facilities to complete a community health needs assessment. Alva is not a nonprofit facility. However, it's great. They want to get the information, engage the community. But there's a lot of facilities, particularly rural facilities in Oklahoma, who are nonprofit facilities. And we spent a lot of time last year. We worked with about 18 to 20 communities doing the needs assessment for them. When the Affordable Care Act came out, we took what we were already doing. We already had an engaged group of local citizens. Then we just went a couple steps further. We now look more specifically into health data, and we also rely on you all to tell us what are the health priorities. Based on everything we talk about throughout the process and what you know about your local community, nothing replaces what you know about your community. What do you see as priorities? And then for the nonprofit hospitals, we go a couple steps further and talk about what can we do or how can we do it. We identify the what we want to change, and then talk about how do we change it. So again, Alva, the folks at Shared Medical Center said, you get some really good information out of it. Let's do it. Even though we're not a nonprofit, let's stay ahead of the curve and let's do the needs assessment. So pretty much I summarized that slide. Again, the Affordable Care Act, nonprofit facilities must complete a community health needs assessment report, and there's also 3 financial pieces that they must write out that came out as one of the things in the Affordable Care Act. So just to kind of give you an overview of what to expect throughout the process, community meeting number 1, that's where we are today. We're going to talk about the economic impact of the health sector, and we're also going to distribute the surveys. Rod is making the round with the surveys. We have lots of copies down here, so feel free to take extras, give them to your friends, your neighbors, your coworkers. We also have a survey link. The exact same questions, it's just electronic. And is it available on the website, the hospital's website? So feel free to go to that link and do the survey online if you'd like. We're asking that all surveys, paper copy, be turned into the hospital by April 4th. And then we'll come back. We'll come back April 16th and present those results. So we have about a month for the survey to run until you see us again. At the community meeting number 2 on April 16th, we're going to go over the survey results and also do a primary care physician demand analysis. This study, we look at your population of your local medical service area and determine how many primary care physicians your area can support. And then we like to have some dialogue with how many physicians are practicing, including MDs, DOs, nurse practitioners, and PAs to kind of compare what the data show versus the current coverage. Community meeting 3, I like to think this is my favorite meeting. Others don't agree, but we talk about health data. We try to make it as interesting as possible. We like to present a lot of maps so you can see how Woods County compares to your neighbors. We really utilize data from the countyhealthrankings.org website. And we also make the county data and information report available. That report right here, it's about 50 to 60 pages. We update this report annually. We like to say it's everything you want to know about your community and your county. We have the sections for economic, health, education, crime, and traffic data. And again, it's updated annually. And actually, if you go to our website, okruralhealthworks.org, you can get a copy of the Woods County Data Information Report. At that meeting, we do not go through the whole thing. Could you imagine 50 pages and just page 3? Here we go. We just pull a few of the tables out of the health section to talk about those, the most pertinent to what we're doing right here. But we make that report available. We bring you copies of it so you can take it. If you write grants, it's a great resource. And we also include the source below each table. So if you need data from the census, we have a lot of population data in there. You can take that reference there instead of going through the census website and working your way through the American Fact Finder. And then here's a copy of the health indicators and outcomes. This is the report where we rely heavily on the county health rankings data as well as uninsured rates from the census. And again, I like to make maps of the data so we can see how your neighbors look in comparison. So any questions about what's to come? And I just skipped over, but that third meeting is April 30th. So we should be finished in a couple months with the needs assessment. At this third meeting, we go through the data. It's about 30 minutes that we'll talk about health data. At the conclusion of that, we will ask you, okay, based on everything we've talked about and what you know about your community, we will develop a list of health priorities and take it back to the hospital to share with what are the priorities, what did we find are necessary for us to change. So, sorry. I thought I was going the wrong direction. So to start, to get into the economic impact, we like to lead with the economic impact because this is the only report we do that actually quantifies how many folks are employed in the health sector and their payroll, and what impact does that have on the local economy. In addition to providing, obviously, care, health services has a substantial economic impact. In some communities, it's the hospital and the health sector is the second largest employer following the public school system. Also, the healthcare sector attracts retirees. Folks do not want to drive a long ways to see their doctor. Families attracts families, small children. If your child falls out of the swing set and breaks their arm, you want to be able to get somewhere close. And also employers, manufacturing firms in particular. That's one of the first questions. If I have an employee get hurt, where do they go? Do they go to Enid? Do I have to take them to Oklahoma City? Where do they go? And next, finally, it's a quality of life variable. When I'm not working with communities, I do research on campus, and I know everyone's jealous of me. But one of the things, and particularly I do community development research, and quality of life is kind of that X factor in why certain areas flourish and others don't. Quality of life is very important, and healthcare is one of those that goes in it's a sub-variable that goes into quality of life. And then economics is my background, so we like to think pictures make everything interesting. So if we give you numbers and pictures, it's all interesting then. So here's just a few pictures to kind of second what was on the other slide. All right, so again, we're going to start big and talk about national healthcare trends and then get down to Woods County and here in Alva. This is just kind of a snapshot of what's happened with healthcare employment and healthcare expenditures over time. So we have 1970 through 2012, and then at the very bottom we have some projections. So if we work across the table left to right, we first have healthcare total expenditures in billions of dollars. The middle row, per capita. So we're taking that total expenditures and dividing it by the population. And then the far right column, healthcare as a share of gross domestic product. I used to work at the Federal Reserve Bank, so one thing I noticed is these dollars are not inflation adjusted, but even if we were to take those billions of dollars and adjust them for inflation, it's still a growing trend. Especially if you look at the per capita, because that's divided by your population. So in 1970, per capita health expenditures were $356. In 2012, it's $8,915, and then we have our projections out to 2022, $14,664. $14,664. One thing to note is the share of gross domestic product. In 1970, healthcare services accounted for 7%. In 2012, it's 17.2%. And then the projections out to 2022, almost 20%, about 1/5 of gross domestic product. One thing to note, a lot of this data is pretty new. And so we did have 2011 number in there. The actual share of gross domestic product has slightly declined, just 0.2 of a percentage point. But it has come down a little bit, which is a positive, but still, it's not 0.2% is not huge. And then on the next column, we have health sector employment. Overall, it's grown. One thing to look is between 2007 and 2009, those were the recession years for the U.S. Health sector employment still grew, even during the Great Recession that we faced just a few years ago. So any questions about that table? A lot of numbers at once. And again, if we have a picture, everything looks better. This is just a breakout of gross domestic product. So we have everything else over here on the left, 82.8%. Health services, 17.2%. So what goes into that 17.2? Hospital care accounts for the 32%, the largest share. Physician services, 27%. Nursing home, 5%. Prescription, 9%. We have other medical, so pretty much everything we didn't talk about, and then government and investment at 16%. Next, we're going to look at Oklahoma and Woods County. This data source comes from the census. It's the county business patterns, and this is an establishment survey. So through this resource, we can gather data by NAICS code, by industry. So we have employment levels and annual payroll. One thing to note, for 2007, 2009, and 2010, if there's very few establishments or very few employees, you get a letter. It says A or B, and for those years, the range is somewhere between 250 to 499. We're not for sure what the number is, but due to privacy, they will only give you a range for those years. So that's, but we do have payroll for those years, but that's just to explain what's going on there. So in 2004, there were 389 folks here in Woods County employed in the health sector. In 2011, it's gone down to 285 folks here in Woods County. One thing to note too, the total county employment slightly decreased about 1.6%. Again, this is 2011 data. The 2012 data should be released in April. We were just talking, Alva's changed. There's a lot going on in Alva, and I'm sure that's probably happened since 2011. So unfortunately, that's not captured yet. We were talking about on the way into town. There's a lot of hotels going up. So unfortunately, due to the lag in data, that's not showing up just yet. The next column, health services as a share of total county employment. In 2004, it was 17%, and in 2011, health services accounted for 12.7%. The far right-hand side, just a comparison to the state. Health services as a percent of total state employment, 15.4% up to 16.8% in 2011. So next, it's the same thing. We're just looking at dollars, looking at how much those folks get paid or how much the payroll is for those. Not surprisingly, there is a slight decline in the payroll for Woods County, but not nearly as large as the employment decrease. So even though the employment decreased 26.7%, the payroll only decreased 2.1%. So those folks employed in the health sector actually saw an increase in their payroll. Two negatives make a positive. I'm just kidding. But it's not as small of a negative, so it's a positive. That's what I hear in economics. That's a joke, too. A bad economics joke. But nonetheless, the folks who are employed in health services, their wages did go up, even though the number went down. Total county payroll is up 65.3%, and again, this is only through 2011. It'd be really interesting to see what happens through 2013 at least, see how the employment and payroll changes here in Woods County. Health services as a share of total county payroll, again, is a decline from 17.4% to 10.3%. And then compared to the state has seen an increase, but they've also seen an increase in the total number of healthcare employees. Next, we just have a snapshot of the economic trends of Woods County compared to Oklahoma and the U.S. Our first two lines, that's from the Bureau of Economic Analysis. They do money. That's the best source if you want anything with money. Gross domestic product, personal income, that sort of thing. So we have total income and then per capita. Again, that's your total income divided by your population. It's good to be in Woods County. Per capita income is higher than not only Oklahoma, but the United States. Typically, if you're in a rural area, you do not see that trend. You see Oklahoma lags the state. Typically, the rural areas lag Oklahoma. So it's good to be in Woods County. The next two groups are employment, unemployment data from the Bureau of Labor Statistics. So Bureau of Economic Analysis, money, Bureau of Labor Statistics, jobs, unemployment. I know we're into 2014 now. We're able to get monthly, just to kind of explain the data, we're able to get monthly estimates, but at the end of the year, they go back and re-estimate their model. So when we get monthly numbers, it's a matter of they have some data, but they're also doing a little forecasting with it. And so when they get to the end of the year, they go back and re-estimate. Unfortunately, the 2013 annual data will not be available until later this month. So we have 2012 annual compared to the preliminary data for December 2013. And I did not feel comfortable creating an average using the preliminary data. So just to kind of explain why we still have 2012 when we're well into 2014. One thing to note, which I'm sure you're aware of, very low unemployment in Woods County. Actually, that's a trend for most of Northwest Oklahoma, very low unemployment. In the annual data for 2012, 2.9%. Unemployment slightly ticked up to 3.4% for December 2013. But a couple things to note. The number of unemployed increased slightly, but you also have a higher number of employed that went up as well. So overall, your labor force increased, is what to gather from that. So even though there's a higher number of folks that are unemployed, that's not necessarily a bad thing. It's folks entering or in the workforce. If we saw an increase in unemployment and a decrease in employment, that's a concern. And that's a trend that we saw during the recession, and that's why it was more of a double whammy. We had high unemployment and then low employment levels. So that's why the recession was very hard on some areas. The next two lines, share of poverty for 2012, and this is from the census. So poverty is tied to income, obviously. So if you have higher income, we can expect to see lower poverty levels, which is definitely a positive. So just total people in poverty, all ages, is 15.2% for here in Woods County. That's lower than Oklahoma and lower than the U.S. That's definitely a positive. Share of children, those under the age of 18 in poverty, 18.2% here in Woods County, substantially lower than Oklahoma at 24.1%, and the U.S., again, lower. So those are very positives to have. Transfer dollars. Transfer dollars are government payments transferred back into the county. So your Medicare, Medicaid, retired railroad workers compensation, those are all captured there. Farm payments are not captured in this category. So anything they get from farm services, NRCS, those are not captured in transfer payments. So if we were to take your transfer payments as a share of your total income, we're looking at 15%. And again, that's lower than Oklahoma and the U.S. So that's a positive thing to see as well. And again, if we have pictures, it's better. I really like data, so if you get back to your office and have any questions about data or you'd like to see some more, feel free to contact me. One thing I like better than data is mapping it. So this is a map of the 2012 annual unemployment rates. And that lightest shade, which Woods County's in, is less than 3%. So you can see northwest Oklahoma, particularly all the way down into Roger Mills and Beckham County, where there's a lot of oil and gas work going on, very low unemployment. The eastern side of Oklahoma, you can see higher unemployment rates. In pre-recession, this is was pretty much the case too. Oklahoma, as we know, is pretty kind of divided. North, definitely in agriculture and landscape, but when we look at income, poverty, and unemployment, it followed some similar trends. So, and then December 2013, again, northwest Oklahoma, very low unemployment rates. The eastern side of Oklahoma, the highest rate is, I guess, Latimer County in that 9 to 10% range, but for the most part, northwest Oklahoma, still very low unemployment rates. All right. And again, I like to make maps. We came and met with Kelly and Candace back in February and to get started with the process. They helped us gather some data. We also had them help us map out what are the zip code areas that you see a lot of folks from. So this is my attempt at an Oklahoma State University map too. The orange areas, we like to consider that the primary service area. So the hospital here in town, they see a lot of folks from those zip codes. The gray areas, there's a lot of folks that come from those zip codes, but they might also go somewhere else. So we're getting kind of close down to Fairview in the southern part, and then up north we have 3 Kansas zip codes. They could go on up north for care, but they still see a lot of folks from that area, but they might also go somewhere else. So as we move forward, we'll refer to the orange area as the primary area and the gray as the secondary service area. Population trends. We have breakout by zip code. In our next table, we'll look at place level. To explain the difference in those, zip code level population captures everyone with that zip code, regardless if you live in town or if you have a rural route way outside of town. If you have that zip code, you're captured in this area. On the next one, is place level. If you live within the city boundaries, you're captured in that place population. So just trends from 1990, 2000 to 2010. For the primary service area, you saw an increase from 1990 to 2000, and then a slight decrease from 2000 to 2010. The zip code area of Alva increased about almost 9% from 1990 to 2000, and then declined 1.4% during that time period. The secondary service area saw a decline overall, between both census years. The Kansas zip codes, they saw declines continuously. Let's see. Oh, Helena, this was captured in Fairview. There's a prison there, and so it really affects how the census calculates that data. Sometimes they count the institutionalized population, and sometimes it's left out. I think pre-2000, that population might have been left out, but starting in 2000, definitely it's captured, and we can kind of dive in to see where that population is. I was in Watonga, and they had a huge increase in Hispanic origin, like 37%. And I was like, what happened? And it was the prison that was captured in their population. So just to note why you see dramatic changes in that population. Next, we're going to look at the place level. Again, the folks living within those boundaries. And we're going to look at 2000, 2010, and then 2012 estimates for the place level. Unfortunately, the zip code population is not estimated every year like the state, county, and place level are. It'd be nice if they were. Just recently, they added zip code data to the American Community Survey, so we are able to get annual data, but it's based on a 5-year average. So you can see the trends for Oklahoma. Woods County, slight decrease from 2010 to 2012. The city of Alva, decrease of 6.5% from 2000 to 2010, and then less than a 1% decline from 2000 to 2012. The overall population has, when we group that service area together, decline of 6.7%, and then a decline of less than 1%. The secondary service area, one of them had a pretty good increase. Oh, Helena, again, the prison affects that. Could be affecting that population. The Kansas zip codes, Hazleton in particular, had a pretty large decline from 2000 to 2010. Next, we share this data because it's important to know the population you serve, the population that's here locally. One trend that we see across Oklahoma is a growing, not only over 65 population, but 45 to 64. So those folks that are getting, the baby boomers, those folks that are getting close to 65 years of age. So in the primary service area, that orange shaded zip code area, the over 65 population accounted for 19.8% in 2000. That's decreased to 17.7%. But it's still larger than the state rate of 13.5%. And again, if we look at that 45 to 64 age range, 21.3% in 2000 up to 23.7% in 2010. And also the state has also seen an increase of those folks that are getting really close to 65. Next, we're going to look at the race breakouts. One trend that's evident in Oklahoma and in certain areas in northwest Oklahoma is a growth in Hispanic origin population. The state rate is 5.2% in 2000, increased to 8.9% in 2010. There's other areas in Oklahoma that have seen a substantial increase. And that affects delivery of services. I know in the Oklahoman a few months ago there was an article about changing emergency messaging. Because the tornado that went through southwest Oklahoma City, a lot of folks did not get the warning or did not understand the warning. So that's just one of the ways that access to care and delivery of services are affected. Overall, looking at the racial breakouts and the racial trends, there's not a lot of change from 2000 to 2010 for the for the primary service area and secondary. If we look at the Hispanic origin breakout, it did double from 2.4% in 2000 up to 4.8% in 2010, which is half of what the state rate. All right, any questions about the secondary data, the demographic data? All right, now we're going to get into Alva. What's going on here in Alva? Again, we worked closely with the hospital together the health sector data here in the community. And you can see the areas who we have data from. So we have a breakout of hospital physicians, dentists, and other medical professionals. Other medical services, we have EMS, home health, and nursing home captured here. And then pharmacies, with 3 pharmacies captured there. One thing we did work out with the hospital, anyone that's paid by the hospital, including clinics, hospice, the folks at the homestead, and our nursing home, we captured them all in the hospital category. So, and we also did this by full-time equivalent employees. So the hospital, 171 full-time equivalent employees, so you can actually go in and count those folks up. Payroll, $6.7 million on an annual basis. And again, these are just dollars that are paid out that you can count. We will estimate the multiplied effects here in a minute. Physicians, dentists, and other medical professionals. We have 4 physician offices, 4 dental, 3 chiropractic, and 2 optometrist offices here in the area with 51 employees and $3.8 million. And again, we did the same thing for pharmacies. If we sum that up, we're looking at 383 employees that you can actually go out and count in the community, and $17.1 million paid out in payroll to health sector employees. And again, we will get into the multiplied effects when those folks make transactions and interactions in the local community. And did I mention economics is my background? Just to give you a brief overview of input-output analysis is what we do to estimate the multiplied effects. Again, I think a triangle just with arrows explains it all perfectly. I'll use me as the example of kind of how we get from A to B here. The basic industry would be Oklahoma State University. I would represent the household sector, and services, that's everything else that I buy in Payne County or in the Stillwater community. So I have an interaction with Oklahoma State University. They pay me, and I provide them labor. And also, I buy things locally. So you can see I get my hair cut, I buy my groceries, I get my taxes done within Payne County. So those are our interactions there. OSU also buys some things locally. I know office supplies they get, or if you get a new desk, it's purchased locally. Paper, I'm not for sure where it comes from, but you also see arrows leaving the economy. So if OSU buys paper from Dunder Mifflin or someone, those are dollars leaving the Payne County economy. The more times we have interactions with each other, the greater the impact. So just a snapshot, there are dollars that come and go in the community, but the more times that we interact with each other, the greater the impact will be. Oh, and sometimes you see I like to say, sometimes you see dollars from the household up to the basic industry. Those are my parking tickets on campus. All right, so this is the final table that's actually at the back of your report there. We have our direct numbers, those folks that we talked about earlier that you can go count the dollars paid out. We have the direct here, the direct income there, and you'll see multipliers in the middle. We get those multipliers using M-Plan software. The best way to sum it up, M-Plan software is very smart. They have, what am I thinking of? They estimate expenditures made within and by each industry. They also know the employment level. They do surveying and gather a lot of the data we already talked about for employment levels, payroll, and estimate the interactions within each economy. I actually sat through a PhD level input-output class earlier this semester, and at the end of it, I was like, I'm just glad I used M-Plan instead of doing this by hand. But the way to interpret the multipliers, so the hospital has an employment multiplier of 1.23. The estimation there is per every one job at the hospital or through hospice, the homestead, anyone that's paid by the hospital, an additional 0.23 jobs are created throughout the economy, the local economy, part-time and full-time. So for every job, we have about 23% of another job spread throughout the economy. So it's not a fourth of a person at a gas station, but it's spread throughout the economy. Physicians, dentists, and other medical professionals, it's 1.35. The other medical, nursing homes and home health is 1.21, and pharmacies is 1.25. So those 383 folks that we can go out and count here locally, with their interactions within the local economy, it actually accounts for 475 local employees. And actually, the 383 folks alone, that's a big chunk of people. It's a big chunk of your local employment sector. And then when we have the multiplied effects, it's even greater. The next income multipliers, those folks have to get paid. So again, it's the same methodology. For every $1 paid to health sector employees, 16 cents is generated in someone else's paycheck because of those interactions. So the $17.1 million paid out to health sector employees actually has an impact of almost $20 million here in Woods County. The far right-hand side, we make an estimation that people buy things locally. And we make a very naive estimation. We just look at total taxable sales divided by personal income, and it's about 29% of income that people have, they spend locally on taxable items. So anything at Walmart, restaurants, anywhere that you have to pay a sales tax, we're estimating. So if we apply that 28.8%, we're looking at about $5.7 million spent here locally on taxable items. And then if you put a 1 cent sales tax on it, we're looking at $57,000 generated just from the presence of the local health sector. So any questions? It's a lot of steps and a lot of numbers. I like to say it's like making a cake. But, all right, just real quick, we will be going through a lot of we will be doing the physician demand analysis, and we'll be looking at health data and the survey results later on. If we have a service that comes up and there's a question, can our local community support that? We have some studies that actually look at the population and different variables to determine what would the potential demand be for that service. Some examples: adult day services, renal dialysis, rural general surgery. Those are assisted living. Those are some of the ones we've done real recently. And also, I have a coworker, and she does a lot of work with EMS too. So on down the road, if one of these services come up, we can definitely help you estimate what could the potential demand be. All right, last but not least, the next meeting, we will be here? Okay, we'll be here on April 16th. Also, please visit the hospital's website for the survey link. Please feel free to take as many surveys as you'd like. We just ask that you get them back to the hospital by April 4th so we can tabulate them and make lots of tables and charts to come back to talk about. So, any questions or concerns? Is everyone still awake? All right. Well, thank you for your time.